What does Grayanotoxin's physiological profile actually look like in a social context? And at what dose does it remain within a safe and predictable range? This is the question worth answering before anyone reaches for a spoon of mad honey, because the answer sits inside the pharmacology, not inside the stories around it. Mad honey has been used in social and community settings across Nepal and Turkey for centuries, but the reason it has held that role is not folklore. It is the way a single compound interacts with the human nervous system, and that interaction can be described very precisely. Mad honey is produced when bees collect nectar from rhododendron flowers, mostly Rhododendron ponticum and Rhododendron luteum. The active compound inside the honey is called Grayanotoxin, and this is the only reason mad honey behaves differently from regular honey on a physiological level. Everything we are about to discuss comes back to this one molecule and the way it binds to a specific part of the nerve and muscle cells in the human body. Grayanotoxin works by binding to voltage-gated sodium channels in nerve and muscle cells. In normal function, these sodium channels open and close very quickly to send and stop electrical signals across the body. When Grayanotoxin attaches to them, it keeps them open slightly longer than usual. The downstream effect of this small shift is what shapes the entire experience. The nervous system moves toward parasympathetic dominance, which is the rest and digest branch of the autonomic system. Heart rate drops in a measured way, blood pressure drops in a measured way, skeletal muscle tension is reduced. The body, in clinical terms, moves into a lower arousal state without losing cognitive function. This is the part that matters in a social context. At a low dose, the documented physiological response is a reduction in sympathetic activity and an increase in parasympathetic tone. In plain terms, the body's stress response settles, but the mind remains intact. There is no documented cognitive impairment at low doses. There is no documented sedation at low doses. Within a low-dose range, users consistently report reduced physical tension and a measurable parasympathetic response without cognitive impairment. This is the pharmacological reason mad honey has been used before social settings, rather than something like alcohol, which produces its calming effect through a very different and much less precise mechanism. The dose range matters more than any other variable here. The recommended starting dose for someone new to mad honey is half a teaspoon, which is approximately 2 to 3 grams. An experienced user may tolerate up to 1 teaspoon, which is approximately 5 to 6 grams, but this should not be exceeded in a single sitting. Going beyond this range moves the body out of the gentle parasympathetic response and into the territory where Grayanotoxin causes a more significant drop in heart rate and blood pressure, which is the point at which mad honey becomes a clinical concern rather than a wellness practice. Timing follows a predictable curve. After consumption, the first physiological effects begin to appear within about 15 to 30 minutes. The full response settles in around the 45-minute mark, and the peak is reached within 1 to 2 hours. The pleasant phase typically continues for 2 to 5 hours before the body returns to baseline. For someone planning around a social event, this means a small spoon taken roughly 90 minutes before arrival places the peak inside the window of the event itself. There are safety caveats that have to sit alongside this profile. Mad honey is not appropriate for anyone with low blood pressure, anyone on blood pressure medication, anyone with a heart condition, or anyone on cardiac medication, because the parasympathetic response stacks with these conditions and medications in ways that can become dangerous. It should not be combined with alcohol, because alcohol independently lowers blood pressure, and the combined effect is unpredictable. It should not be taken on an empty stomach for a first-time user, because absorption is faster and the response is sharper. And it should never be taken in higher doses based on the assumption that more will produce more of the same effect. The dose-response curve for Grayanotoxin is not linear in that way. So the honest physiological summary is this. At a low dose of half a teaspoon to 1 teaspoon, authentic mad honey produces a measured parasympathetic response, a small reduction in heart rate and blood pressure, and a reduction in physical tension without cognitive impairment. That is the documented profile. Anything beyond this, including claims of altered perception or enhanced sensory experience, sits outside the pharmacological record and should be treated with caution. The compound is precise, the dose window is narrow, and the safety margin depends entirely on respecting both. If this breakdown was useful, please like the video so more people see clinical content on mad honey rather than the louder narratives around it. Subscribe and turn on the bell for the next deep dive.